the risk is higher after menopause.
Are there any statistics about the recurrences of cancer after taking tamoxifen within the 5-year treatment?
The tamoxifen decreases the risk of developing breast cancer by almost half, a recurrence of breast cancer by almost half. And the benefit of tamoxifen is maximized over 5 years. So that's why we don't give it to women beyond 5 years, because now the risk of developing uterine cancer is outweighing the benefit of the tamoxifen. But it will decrease it by half. What is the risk of uterine cancer with tamoxifen?
The risk is actually relatively low. It's probably about 1 or 2%. You have a much higher chance, though, of developing endometrial hyperplasia, which is a precancerous condition, or endometrial polyps, both of which can cause bleeding problems.
You gave the best time of the month to do self-examination for people who are still, what about menopause? I didn't hear anything.
Doesn't matter, just once a month. Pick a time, whether it's first of the month.
Pay the mortgage, do it.
Exactly. Suppose it's just as painful.
Doesn't matter.
Oh, sorry.
There's a test that needs to be done for BR. I didn't understand it.
BRCA?
Yeah, BRCA or whatever it is. If the test is positive, is there a treatment for the patient or just leave it alone?
Well, for breast cancer, the treatment is either you can do preventative surgeries, what we call prophylactic surgeries, which means removing all of the breast tissue and doing reconstruction. Or you may opt not to do that and take tamoxifen, which can decrease the risk by 49%. And then in regards to, or a woman may decide not even to do that, in which case we just increase their screening. So we would do mammograms and MRIs. We do them once a year and 6 months of color temperature. In regards to ovarian cancer, you would recommend?
For ovarian cancer, when you're done with childbearing and you're above 40 years old, we offer a prophylactic oophorectomy, which is surgically removing both ovaries and tubes. If a patient opts for that, we would do that. Otherwise, we would do screening, which would include yearly sonograms and yearly CA-125 measurements.
And this is recommended for family with history of breast cancer or ovarian cancer, right?
Right, this would be recommended for families that have a very strong history of breast and ovarian cancer, and women who've been diagnosed with breast cancer before the age of 50, or women that have had breast and ovarian cancer, or women that have had breast cancer on both sides.
And this test is covered by insurance, right?
It depends on your family history.
No, I mean the test, if the patient wants to have this test, and it's covered by the insurance.
It's covered, it will depend on your family history. So what happens with most patients is that we would draw the blood or do the oral swab, and then that gets sent to the company. And then the company will contact the insurance company and find out if they will cover the test. If they don't cover the test, they'll contact the patient to say, do you still want us to run the test? Because the test can run anywhere from $3,200 to $3,700.
So that's why I want to find how it's like saving. That's my next question.
Thank you, everybody.
Thank you.
Before we close, I just want to thank our doctors here today for the information. Just to remind everybody, we have free screenings